Hello, Dania and I would like to update you regarding the new surgical curriculum. You might have seen on the ISCP website lots of information and notifications regarding the new surgical curriculum. The change to the new curriculum will occur on the 4th of August of this year. Following the Shape of Training review and the updated GMC's new standards, surgical training will now be outcomes-based. Trainees are assessed against the fundamental capabilities required of consultants, the standards being that of a Day 1 consultant, managing unselected emergency take, clinics and ward care, operating lists, MDT working, and generic professional behaviours. The new surgical curriculum can be found under the menu option. Each surgical specialty has its own curriculum that has been updated with both generic but also very specific standards and requirements for your surgical trainees. The first significant change is that of the new phases. The training pathway now consists of 3 phases. Phase 1 will follow the core surgical training curriculum. Phase 2 comprises the first 4 years of specialty training to gain knowledge and experience to manage all patients in that particular subspecialty to the point of being able to sit the FRCS exam and surgical competence to include routine day case surgery. There is then a critical progression point which is stated in the surgical specialty for the requirements to proceed to Phase 3. Phase 3 comprises of the final 2 years to consolidate knowledge and experience with technical competence to be an emergency safe surgeon in that particular specialty and to medically manage all cases presenting on an unselected on-call to be competent to manage surgically 90% of these. The next significant change is regarding the assessments. The most significant change is the development of the Multiple Consultant Report, or the MCR, which will become the primary assessment in the workplace, which, together with the other mandatory assessments, will be used by the trainee's assigned educational supervisor to make an end-of-placement report, which will feed into the information presented to the ARCP. The trainees will still be expected to undertake a multi-source feedback, as well as mandatory WBAs for index procedures and critical conditions. There are optional work-based assessments that will be focused on specific learning requirements as discussed with the educational supervisor. At the beginning of the learning agreement, trainee and the assigned educational supervisor will select a lead clinical supervisor for the MCR before they begin the objective setting meeting. The lead clinical supervisor will be able to sign the MCR as soon as the objective setting meeting has been signed off. The MCR should be completed at least 2 weeks before the midpoint learning agreement meeting. Approximate timings for the MCR and learning agreement are shown in this slide. Clinical supervisors will meet at the midpoint and just before the end of the placement to discuss the supervision level reached by a trainee in each of the capabilities and practices, and also whether they are developing generic professional capabilities to an appropriate level for the phase of training. The trainee will also complete the same form as a self-assessment to identify their own supervision level and areas for development. A trainer will meet with the trainee to discuss the MCR and the self-assessment and agree how best to develop in the areas identified. At this stage, it will be useful to show you the MCR, and at the moment there is an ability to trial the MCR on the ISCP website. The first part of the MCR is regarding the generic professional capabilities, abbreviated as GPC. These are 9 generic domains that describe the independent, essential capabilities that underpin professional medical practice. They also serve as educational outcomes and are integral to the surgical curriculum supporting every phase of training. This is the generic professional capabilities section of the MCR. You can see Domain 1, professional values and behaviors, and Domain 2, professional skills. There's an option to select appropriate for phase of training or an area for development, and a free text box should it be required. The other section of the MCR focuses on capabilities in practice, or CIPs. These indicate end point in training. These are high-level outcomes of training and are aimed at helping trainees to better understand what is expected of them in their training program. Each CIP covers everything a Day 1 consultant needs to be able to perform a main area of the job, integrating the knowledge, clinical, professional and technical skills into a functioning whole. There are 5 generic CIPs. For certain subspecialties, there are added CIPs, such as for pediatric surgery, assessing and managing an infant or child in an NICU or PICU environment. The assigned level for the CIPs is based on the supervision levels for the trainee, ranging from level 1, able to observe only, to level 5, able and trusted to act at a level beyond that expected of a Day 1 consultant. This is the second part of the MCR, and you can see how the capabilities in practice, or CIPs, will appear on the MCR. There's an option to select the supervision level based on the criteria as previously discussed, and a free text box to document areas of excellence but also areas for development. This curriculum will begin on the 4th of August of this year for the majority of all surgical trainees. There are a select cohort that may not need to transfer, as outlined as below. If there are any queries, it would be prudent to discuss this with the training program director. Hopefully this update for the surgical curriculum has been useful and not too confusing. A lot of effort has gone into the ISCP website, and I would strongly recommend you read the FAQs on the top right corner, which certainly answered a lot of the questions that I had. The ISCP are also running live drop-in sessions to help answer any questions about the new curriculum. There is also step-by-step PDF guides regarding the MCR and all the new changes with regarding the curriculum. And there are educational videos regarding the new curriculum, CIPs, GPCs, and the new MCR. Other sources of help include your educational lead, the TPD for your subspecialty. The ISCP respond quite rapidly to any emails you might send them, and Dania and I are here to help. Our recommendations are to have a look around the ISCP website and become familiar with the new MCR assessment tool. It'd also be worthwhile having a look at the new curriculum for your surgical specialty to be updated with the new changes and requirements. These changes will affect everyone, especially if you have surgical trainees coming through your department. It will be worthwhile also having a departmental discussion about the MCR and how you will integrate this within your department. The local faculty group meetings may be an appropriate forum for this to be part of. Thank you for your time.